first trimester to give the student a taste of what life is like on the clinic floor. So pretty much from the third month of the existence with us, they start doing head and neck exam, oral cancer screening, taking blood pressure on each other, taking radiograph on each other, and learning about HIPAA and infection control. And then early in the second year, they get to clean each other's teeth and do like simple procedure like sealant. And along the way, they also get to go on different rotations, but they don't deliver comprehensive care. Toward the end of the second year, they start doing treatment planning for comprehensive care. And then pretty much third and fourth year, they spend a little bit of time in the classroom and most of the time on the clinic floor. When you get a chance, if you take a look at this, curriculum at a glance, it shows you how, upon graduation, we want our students to be competent in biomedical sciences, clinical sciences, and behavioral sciences. So through behavioral sciences, there's a lot of emphasis on professionalism and ethics. Clinical sciences, part of it is here on the second floor when they learn to deliver comprehensive care, but there are a lot of rotation outside this building. So they get to work with people who are homeless, they are in jail, they have infectious diseases, they have sexually transmitted diseases, they have been subjected to abuse, and this is over their lifespan. So they will work with infants, toddler, kindergartner, all the way to individuals who are in nursing home. And that is to give them again a flavor of life, what it is like outside, that not everybody graduates from here and can go and have a private practice in Beverly Hills because they are saturated as far as dentists are concerned. And there are people who become interested in public health. There are people who then choose to go for higher education, pursuing a specialty in different area. And that's how I got to live my life. I tried different things, and the more I learned, the more I explored different opportunities, and now I wear different hats. I do research with saliva. I am a member of the leadership, taking care of student faculty. But most importantly, what I enjoy most is when I teach and I'm with the patient because I learn so much from them. There are some facts about PBL, and there are a lot of misunderstanding about PBL. Basically, the problem-based learning is inclusive of different ways and different methods of delivering the material. In some of the cases, you are not going to have any background information. A patient presents with a black spot on a tooth. The mother says, this black spot wasn't on that tooth up till a few weeks ago. I tried to brush and floss, it doesn't go away. What do you think little Johnny, my son, may have? And you are the dentist in the driver's seat, and you have to identify what are the facts. The fact is that you are dealing with a patient who is a child, is male, has a black spot on a tooth, and the black spot wasn't there when the person was born and is not going away. These are the facts. And in the presence of a facilitator, you are going to come up with different ideas. What do you think this black spot can be? And regardless of whether you were a science major or you are changing careers and you used to be a carpenter and now you decided to become a dentist, there are different ideas that will come to your mind. There is no right or wrong way of thinking because we are all human beings and we are entitled to our thought process. So we are going to come up with different ideas. And the facilitator will try to make sure you are not going to get off track, that you are going to stay focused. It's not like having one teacher for 400 students. It is one teacher with 8 students. And we purposely will look at the background of the student to make sure that they are diverse. And they are representing different gender, religion, ethnic group, and background. You come up with different ideas. Somebody may say this can be stained from a tooth. Somebody may say maybe the person was hit on the head and didn't even realize that he was hit on the head. And the facilitator will say, what gave you the indication that this person was subjected to trauma? As compared to somebody who says, well, maybe there's a disease process going on there. That's why the tooth has changed color. And somebody may say it's normal. As we get older, we all are going to have a different colored teeth. And it goes from white to yellow and eventually black. And somebody will say, my grandma, I remember, had black teeth and the doctor said it is a caries. This conversation happens in the presence of the facilitator, and you will come up with ideas that are relevant to the fact that you identify about that particular patient. So if somebody says, Johnny's father must be alcoholic, and because he's alcoholic, he must have rampant caries, and because caries is infectious disease, so that was passed on to John. And the facilitator will correct you, like we don't have those facts, and we are not building on anything that is fictitious. Let's adhere to these facts based on what the mother said, think deeper, and what are some of the ideas that you have. What they try to do is to make sure that when you identify what it is that you want to learn, you don't get out there and get frustrated that there is so much information, how am I supposed to know how to come back with the relevant information? So before you know, you will be surprised how that 1 hour of listening to each other's idea, beating each other's ideas to the death in the presence of a facilitator who knows what she or he is doing, how you come up with areas that you need to know in order to be able to help little Johnny's mom with this black spot on the tooth. So you go through these things. The facilitator will help you to identify those learning needs. They will ask you, where is it that you want to go to learn more about it? They make sure you're not going to say, I will go and Google it. Or I go ask my dad because he's a dentist. Or I go ask my mom because she's a physician. They make sure that they are helping you to come up with resources that are valid, and they assign who is going to do what. So somebody will say, I'm going to go and look at this particular textbook to look at why teeth are white. Somebody says, I'm going to go and find out why teeth turn black. Somebody says, I'm going to go and look at what are the cause of black teeth in kids. And somebody will say, I'm going to go and find out how the color of the tooth can change from white to black when the person was not born with that. So in other words, you will identify learning need, and you will have a couple of days to do your homework. You all are going to turn in your homework electronically, circulate among each other and the facilitator, and the facilitator will give you feedback constantly. And you can ask the facilitator, I went to check out this book, or I went to look at that resource, or I'm planning to give these images, but it's too big, is it too small, is it too comprehensive, is it too, condensed? And then everybody reads everybody's homework. And when you come back, the facilitator will take the first hour of the session, that again is going to be interactive, to quiz you based on what you submitted. Because I could have submitted my homework on type of black spot on a tooth. He may have done his learning need on the difference between the black spot on baby teeth as compared to adult. This gentleman here may have contributed by telling us what may lead to black spot on the teeth, but we all have read everybody's homework, right? So then the facilitator purposely is not going to ask me what I learned. Is going to say, what did you learn from this person learning? To make sure that everybody has read everybody's homework. And basically, the cases are closed within 2 weeks. Within 4 sessions, one case is closed, and at the conclusion of that course or case, based on lingering questions that you may have, there's going to be a research session with the expert. So let's say after 4 sessions, you realize that the black spot on a tooth that wasn't there but came to be is referred to as dental caries. And dental caries is an infectious disease. And the bacteria responsible for dental caries is strep mutant. And the most common path of transmission is direct contact. Everybody, and we have only 144 students, we have 9 teams in the morning, 9 teams in the afternoon, everybody comes to the same set of conclusion because the facilitators have teaching guide, tutor guide, so they know what to place the emphasis on. And let's say when we close the case, the student says, we still want to know a little bit more about pathophysiology or microbiology or pharmacology that was supposed to be covered, but they feel they have questions that wasn't discussed in that group. Then the expert has all 144 students together. That's the only time that the students are all together. And they are forced to stay for an hour or an hour and a half. The rest of the time, they are anywhere doing whatever they want in a small group, and they have access to the facilitator, except for when the case is being facilitated, for an hour and a half. The reason for doing this is to make the session as interactive as possible, to help the material to be sustainable, rather than memorizing something about dental caries and forgetting about it 2 weeks later. The students remember dental caries, not the concept of caries. They remember little Johnny who had a black spot on a tooth, and what they did, and what they learned. So when they're on the clinic floor and they see a black spot, that's how they reflect on that material that they learn, rather than traditional way. If you go to UCLA, there is going to be a PowerPoint on microbiology of dental caries. You will read it, you get together with the faculty, you are given a written exam, you regurgitate what you learn, and you forget about it down the road 2 years later. So that is what really, in a nutshell, PBL is about. But tonight, those of you who are going to watch the debate, is going to be yet another reminder that based on what we are trying to encourage people to do, we can help. We are going to become an advocate for that. Tonight, if you watch Hillary or Trump, to the best of their ability, they are trying to convince people why they will be the best choice to lead United States for the next 4 years. And people listen. And people try to compare. Who is talking about what? All human beings are biased by their thought process. Majority of us make a conclusion and then try to look at facts to support our conclusion. We are biased by where we came from, what type of experiences we had, what we were told by our peers, and how influential those role models were in our life. What we are trying to do here is to make sure that when the students graduate and they are approached by so many people, manufacturers, for different products, for different material, for different technique, patients with different type of needs, with different type of socioeconomic background, with different type of preferences, how are the students going to be free of any potential conflict of interest? Look at facts. Use evidence or science and say, this is what needs to be done for this particular patient. So, to the best of our ability, what we are trying to do is to make sure our students are not going to look at everybody and say, this is the umbrella that's going to cover everybody who is going to present with a black spot on this tooth. Dental care is failing, and I have the choice of silver and gold and composite. Okay, you cannot afford it, we take the tooth out. Because people come with different needs, wants, financial status, ethnic background. The same tattoo that is artwork on somebody's gingiva may be a curse perceived by another culture. But we cannot say, okay, the minute we see tattoo, we are going to gingivectomy, we get rid of it. If we don't show sensitivity to why do you have tattoo there? Or somebody may say, this crazy idea, I saw this guy had a diamond on the top front tooth. Where this guy came from, maybe that has significant importance. Not everybody is knucklehead or psychosomatically, disturbed. You have got to know these things. And that guy who wants to have a diamond on the top front tooth, as a healthcare provider, how do we relate to find out why they have it, and if they want to keep it, what should we do to make sure they don't come down with gum disease, or they don't get dental caries around it, But that doesn't necessarily mean that we are going to encourage people to invest in their mouth and put gold and diamond and rubies and sapphire, because that's the best way to protect your investment. You know what I'm trying to say? So our philosophy is that the dental school is really trying to do its best to prepare people for the future. Having said that, not everybody is the right fit for us, and we are not the right fit for a lot of people. There are students who say, I want to be left alone. Just tell me what to read and where to go, and I will ace it on any type of exam you give me. We don't feel that unless the student practice to use their reasoning ability, they will have the confidence to get in front of a patient and tell the patient, this is really in your best interest, not that. You want me to do this is why I don't do. Because, as a patient, I may come and say, I Googled it and I hear silver filling gives you this type of medical condition. I want all my silver filling out and give me plastic or white material. How do you reason with a patient who may be biased with this type of information? And the reason I'm talking about debate tonight is because, leave aside whether you're a citizen and can vote or not. Leave aside whether you are Republican, Independent, or Democrat. Leave aside what your parents or your peer are forcing you to do. But listen carefully. You see that whether it is taxes or employment or future planning, global warming, people who believe in global warming, they try to give you evidence. And people who are against it, they give you their evidence. In the final analysis, if you are in the driver's seat, you have got to decide what you want to do for that particular patient. And these days, because of the abundance of information, it is really challenging to know what to do, when to do, how to do it. And we live in a country that everybody has total freedom. So anybody can bring charges against anybody. Often the students say, well, just, what if somebody brings lawsuit against me? Anybody can take legal action against anybody. But again, to have confidence that you have used scientific information, evidence-based decision-making to the best of your ability. You did something, you documented it, and regardless of who, even Pope or President or Dean or lawyers, if they come to ask you a question, you can use your reasoning ability to justify why you did what you did. And that's why we feel if you practice for 4 years doing that, by the time you get out of here, it is a habit rather than getting out of here and the first day in practice, scratching your head saying, now what the heck am I going to do? Because the faculty is not looking over my shoulder and saying it. So in a nutshell, this is what we do and this is what we are about. Do you have any questions, anything that you want to ask me? And please don't be bashful. I don't take anything personally. I work with saliva. I pay people to spit at me, and that's why I'm associate dean. So, tell me if you have heard something about PBL that is confusing, or who we are, how we go about things, because I talk for 40 minutes and I'm not used to that. I usually talk for 15 minutes and then I'm listening to see what I can learn from the crowd. But we have like 10 more minutes, 15 more minutes. Shoot, aim. What is it you want to know that I may not have addressed? Yes.
You said that the students have a couple of days to come up with a conclusion for whatever case study they may have. What's to say that they won't go home and Google it, or to try and find out that was dental caries, or not go and ask their parents?
Well, because when they turn in their learning need, which is the assignment, their homework, they have to have references, and they have to cite what source they use for the material that they are circulating. And the facilitator is the one who looks at the validity of those resources. So if you say, I asked my mom, and we encourage people to tell the truth. So if you ask your mom and you put down my mom, how do you know your mom has the most updated information? And basically part of the evaluation and the grades that we submit for the final course grade, you will see it is very complicated for us, for Office of Academic Affairs, but for students it is very easy because everything they do every day matters. So the midterm and final may be like 10% of the final grades because all these homework that they do is evaluated. And the feedback that so when you send your homework and I get it 10 o'clock Sunday night, and I know I see you on Monday or Tuesday morning, I will give you feedback that your resource is not valid. And that is exactly why we don't want you to be biased by expert opinion, because those experts are the product of the past. When the knowledge is constantly evolves. And you can put down my mom based on experience being private practice for the last 25 years told me most people are happier with composite than alloy. And then I will come and I say, come back with scientific proof. Cite the article or the textbook that says backs up. So in other words, now I push you to go and come back to me with data. And that is how you get feedback, and that's why I said it's not like you're left alone to go do whatever you want to do, and when you come back, you say, oh my gosh, I wasted 3 days, nobody gave me feedback, and what I was supposed to do. And we have 6 different occasions when the students who have worked as part of a team all trimester on, now on an individual basis have to do the exact same thing. And that's what we call triple jump exam. When you are given a case, you are given an hour by yourself, and you put down the facts and the ideas, you give me a copy, you go home, and you will come back within 24 hours, and in the presence of two faculty, one has background in clinical sciences, one has background in biomedical sciences, and you show these two individuals what you learn. So the ideas that you have based on that 1 hour time slot were ideas, and it can be right or wrong. But when you were given another 24 hours and you went and you learned about it, now you come back and say, you know, yesterday I thought this is this. Today, based on these resources that I have used, this is what I learned. So it is almost like rejecting or accepting your hypothesis. And that's why I say there's nothing wrong with having ideas, you know? And nobody's going to say, oh, this is stupid. Who gave you this idea? This is what came to your mind based on set of facts that you had. What you learned, and most importantly, what you decided to do with the thought process from yesterday is what we are interested in. And if you come back and say, I thought this black spot is or like food poisoning. And we say, where did you go to back it up? And you say, I Googled it. And then we say, but based on what scientific information or evidence? And you basically say, I really didn't learn anything from it. So things, when they are crystal clear, you start saying, this is what I did, and I'm not going to do anything about it. That is when you may realize that you are not willing to learn from your mistakes. And that's why when you have 80 students working together in the presence of a faculty, and the faculty are constantly giving them feedback, is different than when you are in front of like 120 students, you lecture, and then at midterm you see somebody fail, and then you are trying to figure out what the heck happened, where did I miss the student. Make sense? Yes.
So other schools that put more focus on like didactic type learning lecture style, would you say it's because they don't have enough willing faculty or funds to kind of put into such like an intimate learning setting, or do you think it's because they are trying and that this is the direction that all schools going?
Well, we know that there are a lot of schools that are struggling with the concept, because in 2020, the National Board Part 1, Part 2 is going to merge. And there's going to be only one exam. And that exam is going to be mostly focused on critical thinking and application rather than memorization and regurgitation. And a number of schools have reached out to us, and you are 100% correct. There are a lot of schools that are struggling with the resource that goes into number of rooms, number of facilitators, calibration, and also limited resources. We also know that the Commission on Dental Accreditation, every 7 years they come to say whether you are in compliance or not, has focused on critical thinking and interactive type of experiences. So you will see that a lot of the schools now, they call flipped classroom when they put everything online. They tell you to read this assignment and then come, and then the expert will get in front of the class and we say, okay, what did you learn? My personal bias is that the students are overwhelmed, because now faculty are not communicating. And it's so easy to say chapter 4, 5, 6, and then this one says this syllabus, and that one says that syllabi, and that person says this database, and they don't stay on the same page to realize it is the same student who has to attend to all these needs and show up and then go to anatomy and physiology and pathology. So there is an element of exhaustion, and there's an element of unhappiness and stress among the student, because they're overwhelmed. Like, they want to be pleasing to all the faculty, but if faculty are not communicating, and then this is a typical week that at UCLA, first year student, may have to take 20 exams because they have physiology, anatomy, pharmacology, biochemistry, microbiology, and it again adds to the level of stress. As compared to for us, because we have 4 courses and they're integrated, so they're going to 4 exams. It's much more manageable because the curriculum is integrated. And the mindset that some faculty are more at ease to be in the driver force and driver's seat than to communicate. Sometimes your faculty, you hear, they say, I'm not a psychologist, I'm not a therapist, I don't know how to deal with people. Because when you have a small group and it is more, the learning is happening more as a conversation, it is easier also to pick up and see somebody's quiet. So how do you try to encourage somebody who's quiet to become talkative? How do you encourage somebody who is avoiding eye contact to develop that skill to make eye contact? Because when you talk to a patient, you have to make eye contact. How do you try to say you should respect this religion? Because the person may say, I'm not going to be able to turn in my homework because it is Shabbat. I'm Jewish, I observe, so I don't want to work after such and such time. Another person says, Sunday morning I go to church, so I cannot meet this one. Another person may say that, I don't even have belief in God. And then you see some people rolling eyes, what the heck are you talking about? And then you see that the discussion is about, is there God or not? Which is the best way to teach, to respect other people's belief. That we should not judge people based on where they came from and what religion they have and what type of financial background they have or what type of, artwork they have displayed on their body. And that is how we teach cultural diversity. Rather than like a PowerPoint presentation talking about 4 people with 4 different scenarios and saying, okay, now you all know, be good, be on your best behavior, be nice to your patient when you see them on the clinic floor, don't pick up fight on the clinic floor, so done, you're all passed. You had a question.
Do the instructors come up with these cases, or are they like actual patients who've come to the clinic before?
For the biomedical sciences, most of the cases, it took us years to write and adapt. In the 3rd and 4th year, there are real cases that we saw on the floor, and that is when we do treatment planning based on the given condition, and we have the picture of the teeth and face of the patient covering the eyes, and we asked for the student to come up with a plan, what they want to do. So it's a combination of both. And we keep changing the cases. So that's why I always tell the freshman, don't listen to the sophomore, because they guide them, they mean well, but sometimes they give them information that no longer is applicable because we have moved on and we have changed it. You had a question?
I did. So do they assign readings alongside the case studies so that the students here are exposed to the same sort of information that students are exposed to in more lecture-based schools?
So the curriculum content, if not identical, is comparable to what is being taught elsewhere. Because the aim is for everybody to be competent when they become dentists and pass National Board Part 1, Part 2, and licensure exam. And that's why I said that the facilitators have tutor guide. So if the intended outcome of this case, little Johnny, is dental caries, microbiology, pharmacology, and cleaning teeth, they will facilitate the process such that the student will go and learn about that. And that's why when they come back, they have touched pharmacology and microbiology, and the cases build on each other. So the cases are parallel with the skill that they are developing in the lab. So in the lab, they learn how to prepare teeth for dental caries, when it is a small teeth as compared to bigger cavity, and the cases become more and more complex based on what it is that is going on in the lab and what type of rotations are going on. Yes?
Do you think there's any downsides to PBL?
Yes. Did you all hear the question, downsides to PBL? There are students who don't really want to interact. There are students that they want to be left alone. They don't want to be part of group learning. And that's why that is a disadvantage, and they choose, it is hard for them to adapt. And that's why I encourage a student, potential applicant, to come, to talk, to look, to read about it. The other disadvantage is if you don't stay on track every week, you are going to fall behind very fast because you have got to learn and build on it, and the cases are like 2 weeks. So then you go. So that's why it is advantageous to the faculty to see that the students are moving. But to some students, it is a disadvantage because they say, what if I want to take a few weeks and just relax? In the traditional way, I know to go to the textbook and read a couple of chapters. The disadvantage is the fact that you have to turn in assignment and there's a deadline for it. And it is almost every other day. So the advantage is you are forced and you are programmed and you become like a robot. Turn this in, do this, and before you know it becomes a habit. So those are some of the disadvantages. There are students who say, just tell me what you want from me, and I do my best. So they want us to say, go read chapter 2 in microbiology of dental caries and come prepared to do this, this, this. They get frustrated when we practice with them to think and think deeper and deeper, use your reasoning ability. So those are some of the reasons that people may say, I'm not the right fit for this place. Yes?
Is the work of the student assessed based on what the group produces or individually or some mixture of both?
It is a combination of both because you are going to be evaluated based on what you deliver, but you also will be evaluated based on what you did to bring the best out of others by giving feedback. So when you turn in your homework, then at every session, the 1 hour when the faculty is asking different questions, before that, 8 of you will get together and you give each other feedback. So you may tell me, the homework you submitted was so overwhelming. You had 40 pages, you had 10 images. How am I supposed, to know exactly what to focus on? And he may tell me, I really love the way you capture in the summary the major point. And he may tell me, I love the way you highlighted things because that is the message that I will go home with. This is in the privacy of the vault, in the absence of the facilitator. When the case is going to be closed, like the last session of the case, which is usually the 4th session, in the presence of the facilitator, you have to do your own self-eval. Then you have to do peer eval. And you have to do the facilitator eval. So the facilitation, evaluation of the facilitator that you do, so if I facilitated this case and I had 8 people in my group, I will receive 8 evaluations, not me, my division chair. So I have any way of knowing who said what. So it is anonymous, but at the end of trimester, I get, if I have facilitated, let's say 4 cases, and I had 8 individuals, I get 32 comments, and I am ranked. So that is how we use the feedback to develop faculty. So at the end of every trimester, I have access to everybody's evaluation. I don't know who said what, but I know what was told about the particular faculty. So those who have been praised for their efforts, they get an award. Those who didn't show up, or they were not approaching the student in a humanistic way, or they were late, they get feedback, or they got off track. And I also monitor the major learning outcome. So when we close the case, the student get into this database and they say, little Johnny's case, we learned microbiology, dental caries, pharmacology. And I will see that 7 groups are on track, but 1 group mostly focused on microbiology and pathology, right? So then I will give feedback to bring that facilitator more on track. And because our resource session, pretty much the expert will get in front of the class. We have orientation for MCQ exam they have to give. We have orientation for Kanban when they have to look at images and identify structure or function. And then we have triple jump when they just have to come prepared to have a conversation with 2 faculty for like 20 minutes. So it is different way of evaluation. Sure. What else do you need to know?
It's 6 o'clock. Yeah,
It's 6 o'clock, so you have to go. So again, I don't know how to thank you. They can give you my email address, and if I can be of any help, the only thing I cannot do is to help you with your application for admission, because that is conflict of interest. But otherwise, let me know how I can be of help.